Good afternoon, everyone. How are you all? How are you? So I'm Katrina Quinlan from Comms, and you're welcome to the last in the series of these communications roadshows. So the format for today is 4 short presentations. So the first two are Noreen Spillane, COO, and Noreen's going to talk about the new health regions and the Urgent and Emergency Care Directorate. And then we'll have Suzanne Dunn, who's going to talk about the 2018 to 2022 strategy achievements and health and wellbeing. So there will be a Q&A afterwards, so you're all welcome to ask questions after the presentations. And for the people who've joined us online, the Q&A is already open, so you can put in your questions and we'll ask them for you afterwards. And also the session has been recorded, so we'll circulate it afterwards for anyone who couldn't make it. Okay, so Noreen.
Thanks very much. Good afternoon, everybody. So I'm just going to talk to you about the new health regions, the RHAs. I'm sure you've all heard about them at this stage, and also the new directorate, the Urgent and Emergency Care Directorate, and then I'll hand over to my colleague Suzanne Dunn. So the new health regions, just make sure I have the right slide, yeah. So the new health region, the plan is being finalised at the moment and then will be submitted to the Department of Health, but it's at a fairly advanced stage at this point in time. And I suppose it includes the following commitments, which is around integrated care in terms of our community colleagues. And so all health and social care services will be integrated in line with local population needs. Certain specialist services and functions will continue nationally, for example, the NCCP, which is the National Cancer Control Programme, because they obviously have a very broad remit and will still be feeding into them nationally. And also in terms of strategy around the National Cancer Care Programme, for example, it would make more sense that some of those functions would remain nationally. Also, we'll have a focus on prevention and health improvement and early intervention. Because at the moment, I suppose all we see is the patients that come into hospital, so it'll be a much more population-based, focus with our community colleagues. And voluntary organisations will be governed regionally also, and there'll be a measure and an evaluation system. So I don't know if you can see that slide very well. So there'll be a health region CEO. So here in this region, as you know, we have our community colleagues and we are co-terminus with the community. In some of the other regions, there are a number of community healthcare areas that will be linked with the community with the acute hospitals. But here we're very lucky, we work co-terminously with them in terms of exactly the same geographical area. And we already work very closely with them, and many of you will have integrated with the community already. So for the time being, there's going to be a new health region CEO, and there's going to be, for the time being, they're going to leave the CHO chief officer, and our chief officer at the moment is Maria Bridgman, and our hospital group CEO, as you know, is Colette Cowan. And then there's also going to be senior management team, and once the CEO for the region is appointed, they're also going to look at what the support team then for the new CEO will look like. So we don't have, so they're planning nationally on it. There's been a lot of discussion and consultation about it, but until the Department of Health, I suppose, finalise those plans, and then as soon as we have those plans, we'll share them with the staff as well. So at the moment there are 15 chief officers and hospital group CEOs, and they're going to remain in place just for the time being. So there's going to be very little change at front line really at the moment. So the priority areas then for the health region is our leadership, vision and people, and that's really around engagement and establishment of the health regions, which is what we're working towards at the minute, and reform of the HSE centre, and we don't really know what that looks like at the moment. So at the minute, the UL Hospitals Group, we report up through the acute hospital division, and the community report up through their, their division, as it were. But I think the centre is going to be I suppose, disbanded to some degree or reformed in line with the new regional health areas. And we don't really know what that's going to look like just yet. The new CEO is obviously looking at that at the moment. Then the model of integrated care and healthcare governance. So there'll be an integrated service delivery model, and that'll be based then on local health needs assessment and on population, and it'll be delivered through performance management. And then in terms of planning and finance, the service planning will be based on the population-based resource allocation. So there'll be one budget for one area. And then the infrastructure around capital, ICT and digital. As we mentioned, service planning already, so it'll be service planning for the one area. At the moment, we try and plan for the acute services, and obviously the community plan for the community services. But that will all come together then as part of the new regional health authorities. It'll be based on our population, and the resources will be allocated on that basis. And we will have a capital approach that will again be an integrated approach. And ICT and digital, as we know, are really important to support the new RHAs. Now, while I'm calling them RHAs, actually the term has been replaced by health region. And each health region has its own name showing its purpose and area it serves. So we here in the Midwest will be HSE Midwest. So it's the HSE plus the region is the preferred interim name option. And that could, of course, change in time to come. And the HSE logo then will be used for all health regions. And this model will be applied to the health region implementation plan and all supporting communication and recruitment, etc., and planning. So these are the new health regions. So we have the HSE West and Northwest, HSE Dublin and Northeast, HSE Dublin and Midlands, ourselves, HSE Midwest, and HSE Dublin and Southeast, and HSE Southwest. So we're the easiest in the sense that there's only one community and one hospital group. So then phase 2 will be running in parallel and will be delivered by February 2024. And that is around extensive consultation with the public, patients, partners and staff. And some of you may have been involved in some of the consultation process. We've had several days here in the Midwest. They're going to do an audit of materials to include signage, print, digital and service assets, and a comprehensive visual identity system for the HSE and regional health regions, and a detailed toolkit then for ease of implementation. So that's where we're at the moment. So this year they hope to appoint the CEOs, and by January then of next, and to have them in place by January of 2024. That's the plan at the moment. And then they and the senior management team, they'll be looking at that in parallel at the same time. So then just to move on to the second presentation is just about the Urgent and Emergency Care Directorate. I'm sure some of you or maybe all of you are familiar with it. It's a new directorate. And the purpose of it is to ensure that the patient gets the right care at the right time and in the right place. And it's really about maximising the assessment units and the injury units. And we hope to improve patient flow across the hospital group, and there's been lots of improvement in that area already. Improve planning and sense of urgency regarding timely care and easing the ED congestion. There's set KPIs for patient access to care and outcomes, and there's a particular focus on older persons. We're developing patient pathways, for example, ambulatory care and admission avoidance. So I'm sure you've heard of ICPOP in the community. So that's the integrated care program for older persons. And they also have a chronic disease hub in the community. And it's really about how do we join up all the dots and how do we make the best possible use of all of the different pathways and making sure that the patient is in the right place at the right time. So I suppose just there on the right hand side you can see that, you know, this new directorate, we hope to streamline admissions, optimise discharges and reduce admission rates in the first place by linking all of the different pathways together. So the position paper was completed by the CEO, and it's in a number of phases, and in phase 1 it includes, so the new directorate will encompass the emergency department, which was previously part of the medicine directorate, the acute medical assessment unit here in UHL, the medical assessment units at Ennis and Nina, and the injury units there also. And then the operational ADON team, the patient flow team, including the bed bureau, OPAT and the operational add-ons are all part of the new directorate. And then in phase 2, we might look at the acute surgical assessment unit becoming part of it also, the paediatric ED and the acute fracture unit. So medicine then will stand alone as a directorate in terms of the medical wards and the specialties, etc. So the benefits then, provides us to focus and have oversight in one of the hospital's highest risk areas, which of course is the emergency care department or the emergency department, and making sure that patients flow through that system as seamlessly as possible. We hope to have enhanced leadership, culture and governance, improving, as I said, the patient flow both pre and post admission, focused operational oversight, and enhanced our add-ons and patient flow relationship. They work very closely together, as you know, at the moment, in terms of patient flow, both in ED and also on the wards, and it's really to bring that team together. So the leadership then is the Director of Management team. The General Manager is Tina Fitzgerald, who many of you will know. Director of Nursing, Michelle Cook, also well known to most of you. And our Clinical Director was only appointed last week, and it's Dr. Damien Ryan from the Emergency Department. So it's run as completely separate directors with a huge focus. And I suppose, in terms of governance then, sorry, just before I move on there, just to say as well that Mike Conlon is here in the audience with us, and just Mike will oversee that directorate specifically as the Head of Service for Unscheduled Care. The medical governance, so under the new directorate, the ED consultants will come under the new directorate. The ED, MAU, injury units, medical assessment units will all be part of that new directorate. And also then the medical consultants will remain under medicine for the time being and will report into the clinical director for medicine. The governance of patients in MAU that require admission will remain unchanged, so they're under the medical consultants also. That's a very busy diagram, but you can just see there the new directorate with Mike there as head of the new directorate. Okay, so I'm going to hand over to Susanna, who's going to talk about the achievements in the group strategy.
Hi everybody. My name is Suzanne Dunn. I'm the Chief of Strategy and Transformation, and it's lovely to be here to tell you some of our achievements under the last strategy over the last 5 years. And I just really want to say I'm here, relaying some of this information, but I just really want to acknowledge all the work of the teams that have actually achieved this. Many of you are project managers and certain things, so across the sites, just to say thank you. So under our first strategic priority, we looked at clinical transformation, and this was around optimising our resources and our capability across the 6 sites. So just to give you a whistle stop of a couple of key projects under each of the hospitals. So in UHL we had an additional 98 inpatient beds and 10 critical care beds. We also had the implementation of the molecular lab and a new acute fracture unit. We also have the expansion of the PEDS ED, and in the maternity hospital we had the neonatal extension unit, and the paediatric cardiology services were also developed, and they provide an excellent service for cardiology outpatients for paediatrics. In Croom we had a very impressive 4 theatres built. It was a 15 million project, and there's 24 bed MAIC single room facilities out in Croom as well, which on a couple of occasions we've had to convert to a medical hospital, and teams really rose to the occasion at the time and did that. And also a pain management centre, which is very impressive in terms of reducing their waiting times for patients who have severe pain. So they've got the waiting list down significantly in the last few months. In terms of Ennis then, they have a new injuries unit, a new outpatient facility, and the upgrade of the MAU as well. In Nina Hospital, we've delivered a new sub-fertility ambulatory gynae hub, a heart failure support unit, and a dedicated cataract centre. And in St John's Hospital, they've relocated their AMU and increased the injuries unit, which is now open 7 days a week. And I just think it's really important at this juncture just to mention our CEO, because so many of these capital developments were done really strategically and behind the scenes before they were developed with our CEO, Professor Colette Cowan, and Joe Hoare in Estates as well. So I really want to acknowledge that that's a lot of where these projects have materialised. I think you'll all agree the infrastructure of the campus has changed significantly over the last 5 years. So in terms of digital health then, so we have a couple of key deliverables. We set out to really further enable UL Hospitals Group around the future digital leadership in Irish healthcare. And some of the key deliverables were, and you'll all be familiar with this one, the red to green in terms of patient flow system to improve the journey of patients across the site, the digital dictation in the histology department, the blood sciences project, which is an automation of biochemistry, the hematology, the coag and the serology, and they really have improved in terms of the quality and safety of diagnostic testing. So another very impressive project in the Diagnostics Directorate. And one that's very successful as well was the clinical information system in the ICU. And this really keeps care at the bedside for patients, and it also has, you know, streamlined processes and practices such as medication management. So it's having a direct impact in terms of the patient benefiting, and I think it took a while to get that project in, but I think people really see the value in it now. In terms of our next strategic priority then, it's education, research and innovation, and this was all around improving the quality of life of our patients and the population. So two key projects that we set out to deliver under this priority were setting up and developing a health sciences academy, and also developing our robotic surgery programme further. So we've achieved these two, and Professor Burke, as you all know, is the Chief Academic Officer over the Health Sciences Academy, and Miriam McCarthy is the Manager. And under their leadership, some of the key deliverables that have been achieved are structured education projects for type 2 diabetes. They've also been collaborating around the Limerick Digital Cancer Research Centre, which is really, really important in terms of understanding cancer and the biology of cancer, and then finding new ways and looking for ways to improve, prevent, diagnose and treat cancer. So this is a very exciting project. Also, some of you might remember the intermediate care facility that was set up in the UL Arena, and that was a wonderful project, and we had to adjust and adapt. So we thought it was going to be a field hospital initially, and thankfully we were not as serious as Italy was, and so we didn't have the same need for it, so we had to reinvent it as another medical support system for the hospital at the time, and some very good research and data outputs have come out of that project. So just to acknowledge everyone in that as well. We also then, under one of the other key ones was the Junior Health Sciences Academy. So we've over early careers, there's over 10,000 students dial in now annually to look for careers options in UL, which directly hopefully will send us staffing, and that's proved dividends already. And in terms of care aware crews, this is where the teams went into schools to 3rd and 4th class students, and they actually taught them all around health and wellbeing promotion and being ambassadors for that in their schools. So another nice project in terms of the Health Sciences Academy. And then in terms of the robotic surgery, we've had over 600 procedures completed under 3 specialties. So we have colorectal, urology and gynecology, and the gynecology has, particularly in the last couple of years, been extremely successful in terms of being leaders now, and one of them certainly in Europe around robotic gynae surgery, Miss Osma Mahmood. And in terms of next plans, the CEO is already in talks about getting a second robot to be used for day surgery in the Model 2 hospital, so we're hoping to watch this space in the next few months. So our next collaboration then, just to give you another quick overview, is the 4th one around collaboration and alliances. And this is where we're looking at the strategic, where we need to place ourselves in terms of working with people outside our organisation. So one of the key projects that we achieved was Learning for Lives Ghana, which I know many of you will have been familiar with it, but it's an important one in the life of our strategy. And this is where we provided pre-hospital emergency care to 200, the easiest way of saying it is healthcare workers in the community and the hospital. And we also did train the trainer programs. And the project was recognised by Esther. It was accredited, and it was also recognised and awarded by an award by the Mayor of Limerick as well, which was really, really nice, and it was a great honour to be part of that project. Another one that under collaboration alliances was the Pathway for Prisoners. So this is where we looked at working with the prison service to improve the experience of prisoners that come into our hospital setting. And also one of the important ones in COVID that has continued since is the interagency group in the Midwest, and that's where we worked with, say, NAS and our community colleagues and others in terms of collaborating around COVID and any such major incidents that have happened since. So I think that's just a whistle stop of some of them. We also have, just to mention, that the full strategy document is on the website, our own website here, and we also have a published version as well. If anyone really wants one, you can let me know. And it gives you the strategy update of everything that's been achieved in the last 5 years. And these are only possible with our enablers, and our enablers in the strategy were HR. So our people and culture. So the recruitment was 4,377 staff recruitment approvals were achieved over the 5 years. And I just really want to say the work that the HR department have done in terms of recruiting and employing that level of staff has been really, really significant. And I know it was almost 1,500 of those were NCHDs over the 5 years. So they really have done tremendous work, not just in recruitment, but also in other areas like performance achievement. I know you're all working in certain things, and the certificate in management as well, which is sponsored by the CEO. So we also looked at then under nursing, then the rollout of the framework for safer nursing staffing. And I know many of the nurses, I hope, that are in the auditorium will realise that there has been a huge benefit to the safer staffing that's been driven by the chief nurse. And also then in terms of the values in action, it's something our CEO wants us to reinvigorate very much, and you're going to see it coming back into, now that we're post-COVID, it's something that's really important to the CEO in terms of making sure that we are improving our patient experiences and our experiences with staff as well. So then in terms of operational excellence, I think the crew has gone through a lot of what's been achieved in terms of operations, just with the 10 additional discharge planners. I know Mike is doing great work, and William before him, around really trying to get that operational excellence across the sites. And I think everyone can see the difference. And I see Linda in the audience as well does Trojan work every day, and many of you, to make sure the right patient is in the right bed at the right time. We just really want to say around finance as well, just it's another enabler as well. And they have done an awful lot of work in terms of the financial reporting and enhanced reporting. And I really want to shout out the finance department here, because an awful lot of the papers and strategies, etc., that we're writing, they come in behind those and give huge support to the CEO department and to myself as well in terms of getting those reports done. And so I just really want to acknowledge they do an awful lot of work behind the scenes, and procurement as well. And in terms of development of the ABF, then they've also developed an implementation plan for that as well. So they're just another couple of highlights. So I just want to talk to you about health and wellbeing then. So we have a new Healthy Ireland National Implementation Plan for 2023 to 2025. It's just been launched. And just a couple of key things that really struck me when I read it. I was very privileged to be part of the steering committee that developed this paper with Dr. Philip Crowley and Sarah McCormick nationally. But a couple of the key things that I think are interesting for all of us, on the ground and frontline with patients, is that, chronic disease and their complications account for up to 80% of GP visits. There's also 60% of hospital bed days are actually taken up with patients who have chronic disease, and 55% of the acute hospital budget goes on patients' treatment of chronic disease. So 30% of cancers and 80% of heart disease and diabetes could be prevented by addressing modifiable risk factors such as smoking, alcohol use, poor diet and physical inactivity. So promoting health and well-being and preventing chronic disease is a critical component of creating a sustainable shift in our national approach to delivering healthcare. And we're also focused here in the paper, but also locally, on reducing carbon emissions, recycling and food waste as well. So just a couple of key factors there. And so I feel a fraud here now presenting this because Niamh is the expert in chronic disease prevention, and Niamh is doing great work around the Tobacco-Free Roadshow, and she's going across the sites to promote availability, for patients and staff, and providing free services and also free nicotine replacement for staff. The tobacco-free campus is being reinvigorated again, so you'll see that, and we're going to have a very strict policy on it. So it's just been set up by Maria Quirk at the moment, and we're going to be really aiming towards eliminating smoking off the campus entirely. The staff training on smoking cessation support for patients, and there's an integrated maternity stop smoking service in the maternity, and he was pivotal in resurrecting that and working with the maternity as well. And it was a very successful example of how we can work with our community colleagues in preventing smoking and continuing care into the community. And we also have stop smoking support for staff, so if anyone's interested in that, contact me directly. So in terms of making every contact count, then we're looking at engagement with clinical teams in MEC to approach to support patients with chronic disease prevention and management. There's training them being promoted online and e-learning. And if I could encourage any of you, if you are approached by health and wellbeing, in terms of being a MEC ambassador for the wards and a MEC, it really is all about getting MEC up and going for these few months again. And then implementation, supporting teams to implement it, and then Niamh continues. So we're going to be a pilot site for MEC Digital, which is a very interesting one. So the Cath Lab have signed up for that, and the MAU and NINA as well. So we're looking forward to seeing the results of that. In terms of health promotion then, just the staff app, we just want to give that a shout out. If anyone's not on the staff app, everything with health promotion and promotions are on the staff app, so download it if you haven't already. And just promotion and communication campaigns for local and national awareness days. Some of them are there on the board, and on-site promotion for staff and patients, such as Heart Failure Awareness Day and No Smoking Day, etc. So great work by Niamh and her team, and really thank you for that. So I'm not going to focus on this slide because I've done one specifically for the UHL, but it's just to give you a synopsis of, there are so many initiatives now going across the 6 sites, and health and well-being really is alive and well. So if you're not involved in anything so far, we really want to get you there. And just in terms of giving you a brief synopsis of what's going on across the site, you'll see the variance on the 6 sites, and we'll take some ideas and bring them in here and vice versa. But there's wonderful work done by Emer and Niamh and Joe in terms of implementing health and wellbeing across the sites. So just when we look at UHL in particular then, so we've had, our Staff Health and Wellbeing Centre opened. We've had gardening workshops, the Staff Appreciation Day. Did you all get your ice cream? Yeah. And you would give out free ice creams to all the sites one day in the year. Mindfulness sessions with particular sessions for the emergency department, because of the critical nature of what they do as well, and the difficult circumstances with which they work at times. Also the Staff Health and Wellbeing Survey, that's out. So as soon as we get the survey, we get the results. If there's 12 or 14 recommendations, they're usually implemented within about 3 months. So we take it very seriously what our staff say. So if you see them coming out in the next few months again, we've implemented all of the recommendations of the last one. So you really are the driving force behind the health and wellbeing. And then we're supporting non-consultant hospital doctors with direct communications now, because we know there's a need. They work under very difficult circumstances at times as well. In terms of active living then, we've had Couch to 5K, Health and Wellbeing Centre. There's 8 classes run freely. This does not happen anywhere else in the country, that a hospital puts on 8 free exercise classes for staff a week. So it's a fantastic initiative, and I'd say make available whenever you can. And we've run specific ones at 7 o'clock in the morning when, if nursing team said we can't make the middle of the day, can you run? We've done that as well. So if you need something, just reach out and ask. So the Great Limerick Run, we've been part of that, the Steps to Health, and the UL Hospital Group Cycle. And I really want to say what we're hoping is to get the 6 sites involved, and I've said that in every roadshow. we'd love to triple or quadruple the numbers for the next cycle. And really, just William has been huge support in terms of that success and organisation and implementation as well. So St Patrick's Day run, we've been involved in that, in the Santa Dash, and then some of the chronic disease, then I've gone through those already, and the Arts and Health Committee is now set up again, and we've re-established that, so there's good work coming out of that, and you'll see some changes to the art on the walls in the hospital in the coming months. We've had National Poetry Day, the Reimagine UHL project, so that's where we got awarded, we applied for funding, and we got awarded proof of concept for Reimagine UHL, a walkway around the hospital, and we also want to do a memorial for staff who've passed away in COVID-19. So we said that before, it's not forgotten. We just need to get the bigger funding now to go out and actually implement it. But the project, the proof of concept and the work is done in relation to the initial project, and thanks to everyone who was involved in that. And the musical notes are back on the board as well. We have huge success around Healthy Eating Awards. So all 6 of our sites now have Healthy Eating Awards. Most of them are actually gold. In UHL we have a silver award, which was an absolutely huge achievement because the amount of work that had to be done. I really want to acknowledge the catering department in doing that, because they went to great lengths to get to the silver award. It's very, very difficult for a hospital of this size to get to gold. So there's a couple of small changes, and we're hoping to go for gold in the next time around. So well done to the catering department. And that's the arts and health that I mentioned already, and just the Helium Arts workshop as well. That in particular around our supporting paediatrics with chronic disease conditions as well. So I want to mention that project in particular as well. So it's really important as a hospital group that we give back to our community. So we put it out to the executive council team. We put several charities and we asked them to vote, and the unanimous vote back was the Midwest Simon community. So we have raised almost €5,000, which was presented by Ms. Emer Laughlin to the Simon community just a few weeks ago. So it's fantastic, and just to thank you all across the group for having raised that amount. And a lot of it comes through the cycles as well. So everyone who registers for the cycle, I think it's €20, but all of the money, and then we have buckets on the day, so additional money goes to them as well. So really encourage you to maybe head for the cycle in September when you see it advertised. I'm not a good cyclist, but I go on it and I do a bit and best, and it's such a fun day. I can't emphasize it. So that's just a whistle stop of health and wellbeing. It really, really matters to all of the staff. It's on the executive forum every single week, and we really care about our staff, and I really want to get that message across today. So if there's anything that you want, it's really important that you let us know, and thank you so much, and we'll take any questions and answers now. If you have them.
Yeah, okay.
Anyone wants to ask a question? I have a microphone here.
Yeah, so I can speak loudly enough.
Sure, it's just for the people online might be able to hear,
yeah.
so yeah.
Is there any work we're doing locally to prepare for the RHAs, and if so, can you sort of outline what it's about and information for us?
Yeah, so that question was about any work we're doing locally or to prepare for the RHAs or the regional health authorities. So we are doing some work here locally. A pod has been set up, and the pod is where the Chief Executive Officer of UL Hospitals, Niall Murray from the National Ambulance Service is the General Manager there, Joe Hoare from the States, and Public Health, Dr. May Mannix, the Director of Public Health. So they have a meeting now where they, in preparation really for the new region. So that has already been set up, which is good. Yeah. We all work very closely together here anyway, because we're already integrated in many ways. So I think, but it's just to put it on a more formal setting. And actually the HSE CEO, Mr. Bernard Gloucester, is coming down next week, and he's going to meet the pod. And that's the first time that meeting is happening here, where he meets the new pod.
There's just one Lauren online asking about the healthcare records department.
and when they're moving, and when they do move, who's going into that space?
Yeah, $1 million question, isn't it? So the healthcare records, as you know, the healthcare record space here in UHL, I suppose hasn't been fit for purpose for quite some time. We've had lots of issues there and lots of changes over the year. Ultimately, I suppose we want to get to a scanning solution, but that's maybe a little bit down the line. And of course, with all of an electronic health record, look at all the clinical people here in particular who, that's where we need to get to. And we'll move there slowly. But in the very short term, we're going to move the records department. There's no exact timeline yet, but it will be by year end. They'll move just up the road to Houston Hall. Some of you were there already. And it'll be a new department. They'll be able to hold more records. It's a huge project because they'll be going off site. The new space then will be developed. It's not a great space because it's bang in the centre of the wards, so it'll have to be a clinical space. So we'll work on that to refurbish it to ensure that it's utilised. Definitely it'll be used, but it'll be for clinical space. It'll be a clinical space, yeah.
Anyone else?
Yeah, supplementary, sorry. Just a selfish question more than anything else. You mentioned about the new pathways in the new directorate. What's your vision on that and how do you think that will play through, particularly in the context of the RHAs as well?
Yeah, I suppose we're already working, as I said, very closely with the community. We meet them on a very regular basis. We have weekly meetings in terms of unscheduled care. Linda will tell us about the delayed transfers of care. There are patients who are delayed in the system. Sometimes they can't go home for many different reasons, or they have very complex care needs following an acute episode. And Linda and the team work very close. We have already, as Suzanne mentioned, we've put in new patient flow discharge coordinators, and I think that they support the staff on the wards, the clinical nurse managers in particular, in trying to get the patient through the system a bit quicker. But I suppose we need to also look then at, does every patient need to be in hospital in the first place? Our medical assessment units now, it was open, the Ennis medical assessment unit has always been open 7/7, or has been for many months at this stage. And we just extended Nina and St. John's also. So their medical assessment units are open. So where it's more appropriate that patients would come in to the medical assessment unit, we would encourage that. And also, we're working very closely with our National Ambulance colleagues, and patients can now be referred directly to the medical assessment unit once they meet particular criteria. As you know, we have our GEMS unit here, which is our geriatric emergency medicine unit, and all our elderly patients go through that, and it's really about how that unit will link even more closely with and build up the pathways with the community in terms of ICPOP and the chronic disease hubs and other services. So it's really about trying to bring all the services together so that the patient, patient gets the best outcome possible, and that they're assessed in the right place and they're admitted when they need to be. But I suppose it's all about really care being delivered, nearer the patient's home.
No, nobody else? What?
Probably more of a question for Suzanne. So first of all, well done on the extensive health and wellbeing program and you can see the dividends paying across the sites. Just wondering, I know you've done a survey of staff in the past to look at what people want and need from a health and wellbeing perspective, and maybe is that something you look at doing again to engage with people to see, there's a lot of initiatives around runs and cycles and what have you across all sites, and maybe worthwhile again doing that to look at what people feel would be worthwhile from staff health and welfare perspective.
What we've done it in 2022 and the year before 2021. So the idea is that as soon as we receive the feedback from staff, so first time the responses were quite low, if I'm honest. So I think there was around 12 recommendations, and we were able to do this quite quickly, and we had a budget which was healthy, by comparison to the 12. That was very achievable. And then a year later, we got a bit of traction, and we had about 20 recommendations. So they were achieved in maybe 16 to 20 weeks. And all of them, the things that you see are actually things that our staff would have been back on. So they wanted the collaboration of the cycle. The feedback from staff was, please don't do it once a year, we want 2 in the year. So we're running another one in September, and that wouldn't be the way I would have done it, but that's what staff wanted. So everything that the staff have asked for. And we run another one once the year is up, and we get the next recommendations. And we actually have a very, very small budget. And I really do want to acknowledge as well the Chief Financial Officer is extremely supportive and always has been in health and wellbeing. But he really helps me to take that budget to the maximum for our staff as well. So I'm very grateful for doing support on that. But to answer your question, everything, so when we're doing in the next, I'll be talking to Emer about that in the next couple of weeks. And so I would say as many staff as you be back in, really implement what you want. And I really do mean that. And unless there's a budgetary constraint that we have to do it over a couple of years. An example of that is when we had a health and wellbeing centre here in UHL, the sites were saying, well, we would like them too. So Crew have opened theirs just a couple of weeks ago. It's to be formally launched, but they were finished. And Nina are working on theirs, and met Joe Cassidy 2 weeks ago on the Ennis one. And so as many as we can get up so that staff have a quiet space to go and just take that few minutes time. I think that's really important.
Anyone else? Just would you all fill out the feedback forms as well that give us an idea of what you'd like to see in the next roadshow? Thanks a million. That's it.
Thank you very much to everybody for coming today, and also to the people online. So thanks for that. Thank you.